Hello everyone, welcome to Jessie's MedBio. In today's section, I am going to explain about the next topic from the second chapter, that is nutritional needs of children and infants. Under this, I am going to explain about the breastfeeding, exclusive breastfeeding, supplementary or artificial feeding, and last one is the weaning. So first one is breastfeeding. We all know about the breastfeeding, right? So breastfeeding is the natural process of feeding an infant with the breast milk directly from the mother's breast. So it is an ideal method of infant feeding because it will provide full nutrition and immunity and emotional bonding between the mother and the child. So WHO and UNICEF recommendation of breastfeeding are: we have to advise the mother to start the breastfeeding within 1 hour after the birth, and also we have to advise about the exclusive breastfeeding, which means for the first 6 months only the breast milk should be given to the baby. Then also continue the breastfeeding with other complementary foods up to the age of 2 years. The next one is the physiology of lactation. Breast milk production depends on hormone and reflexes, which means the production of the breast milk will depend on the action of certain hormones and also by certain type of reflexes. So mainly two type of reflexes are there. First one is the milk secretion reflex and second one is the milk ejection reflex. So milk secretion reflex is also known as prolactin reflex, which means here the hormone which is acting is the prolactin, which is secreted by the anterior pituitary gland. So how the reflex is happening means the baby suckling stimulates nerve endings in the nipple, which means when the baby start to suck the nipple, at that time the nerve endings which is present in the surrounding area of nipple will get stimulated, and these nerve endings will reaches to the brain as an nerve impulses. At that time the anterior pituitary will release the prolactin, and prolactin will stimulate the alveoli of the breast and it will cause the production of the milk. So the main function is the milk production. The next one is the milk ejection or oxytocin reflex. So the hormone which is acting is the oxytocin, which is secreted by the posterior pituitary gland. How they acting means when the baby is sucking the nipple, at that time it will stimulate the oxytocin and it will get start to release. And oxytocin will causes the contraction of myoepithelial cells which is present around the alveoli. Because of this, the milk is pushed into the lactiferous duct and from there to the nipple, and the baby will get the milk. That is the milk ejection reflex. Milk ejection reflex means the milk is coming out of the nipple. That is about the physiology of lactation. The next one is the technique of breastfeeding. For the positioning, the mother should be relaxed and comfortable, and the baby's head and body should be in straight line, and baby's nose should face the nipple of the mother, and baby's body should be close to the mother and support the baby's whole body. For latching, touch the baby's cheek with the nipple. We have to touch the baby's cheek with the nipple of the mother. The baby opens the mouth wide and the baby takes the nipple and most of the areola into the mouth, and baby sucks rhythmically. And then next one is type of milk. Here around 5 types are there. So first one is the colostrum. Colostrum is the first milk which is produced by the breast of the mother. So it will be present 2 to 3 days after the birth, and also which is thick and yellowish milk. Then second one is transitional milk, that is from the day 3 to about 2 weeks, and it will be in whitish and it will thinner than the colostrum. Then third one is the mature milk. It will present after 2 weeks of birth and it will be thin and bluish in appearance. And fourth one is foremilk. It will comes at the beginning of the feeding and it will be thin and watery. Hind milk means it will comes at the end of the feeding. It will be thick and creamy. You can read the composition and the importance. It is easy only. Then next one is the signs of good attachment. When we can able to say that the baby is latching properly, what all are the signs should be present are the mouth should be wide open, chin touches the breast and more areola will be visible above than below the mouth. Baby's cheek are full and rounded and sucking is very slow and deep and feeding is painless for the mother. And the signs of poor attachment is only the nipple is inside the baby's mouth and tongue remains behind the nipple and baby's cheek become hollow. Mother experiences the nipple pain. These all are the signs of attachment. Then advantages for the baby. How the breastfeeding is benefit for the baby means it will provide proper and complete nutrition to the baby and it will easily digested and promotes the brain growth. And also the breast milk is rich in antibodies, lysozyme and lactoferrin and it will protect the baby against the diarrhea, pneumonia, allergies and certain type of infections and reduces the risk of obesity, diabetes, asthma and some cancers which is present later in the life. Then safe, clean, fresh and at the correct temperature. Then promotes emotional security and bonding between the mother and the baby. Then what all are the advantages for the mother are, it will promote the uterine involution. Uterine involution means what? After the delivery, the uterus has to go back to the pre-pregnancy state. The breastfeeding which will help for that. Then reduces postpartum bleeding, then helps in weight loss and delays ovulation. Then reduces the risk of breast and ovarian cancer and also it is very convenient and economical to the family members and also for the mother. That is about the breastfeeding. Then what is exclusive breastfeeding? That I already explained. Exclusive breastfeeding means feeding the baby only the breast milk for the first 6 months without giving water, honey, animal milk or other foods except the medicines or the vitamins drops which is prescribed by the doctor. Then next one is the artificial feeding. Artificial feeding is the feeding of an infant with milk other than the mother's breast milk. Other than the mother's milk or other than the mother's breast milk, what all are the things we are giving to the baby or what all are the formula milks we are giving to the baby, that is known as artificial feeding. When breastfeeding is not possible or is contraindicated. It includes feeding with cow's milk, buffalo milk or commercially prepared infant formula, that is dried milk formula. What all are the indications for artificial feeding is death or the absence of the mother. Then prolonged maternal illness, which means if the mother is having any chronic illness. Then if breast milk is not producing, then the mother is having TB or if the mother is having HIV or working mother, we can not able to breastfeed the baby and adopted baby was adoptive mother is not lactating. Then next one is method of artificial feeding. Some methods are here. So first one is the bottle feeding. Bottle feeding is a method of artificial feeding in which an infant is fed milk through a sterilized bottle fitted with the nipple when breastfeeding is not possible. Bottle feeding means what? We are giving the milk to the baby by using the bottle. The indications will be the mother is unable to breastfeed, breast milk is insufficient, mother is seriously ill, baby is adopted. Formula feeding is advised by a health care provider. Then the procedure or the technique means we have to sterilize the bottle and the nipple and keep them covered. Then we have to prepare the milk according to the baby's age and the requirement, and change the baby's diaper and wash the hands properly. And then we have to test the temperature of the milk by putting a few drops on the inner wrist. Then we have to hold the baby in a semi-upright position with the head slightly raised, and touch the teeth to the corner of the baby's mouth when the baby opens the mouth, and insert the teeth. Hold the bottle at an angle so that teeth remains completely filled with milk to prevent swallowing air. And after giving feeding, we have to burp the baby, and then we have to wipe the baby's face and place the baby in a right lateral position. That is about the bottle feeding. Then second one is the katori or spoon feeding. Katori and spoon feeding is a method of feeding an infant using a small bowl, that is the katori, and spoon. It is the best alternative to bottle feeding when the baby cannot breastfeed. The indication will be when the baby is premature and cannot able to suck properly, or if the baby is having any congenital malformations like cleft lip or cleft palate, or the breast milk is expressed and given instead of direct breastfeeding, and mother is temporarily unable to breastfeed. For the techniques, we have to wash and sterilize the katori and spoon by boiling them for 10 minutes. Then take the required amount of milk into the katori and keep it covered, and change the diaper and wash the hands properly, and hold the baby in a semi-upright position. And we have to place a soft cloth around the neck of the baby. Then touch the spoon to the corner of the baby's mouth. When the baby opens the mouth, give small spoonfuls slowly. Allow the baby to swallow each spoonful before giving the next one, and observe the baby for the choking and aspiration. Then after feeding, we have to burp the baby, and we have to wipe the mouth and place the baby in the right lateral position. That is about the katori and spoon feeding. Then next one is the cup feeding. Cup feeding is a method of feeding an infant directly from a small cup. It is commonly used for babies who cannot breastfeed but can swallow safely. Give 5 ml extra milk at each feed to compensate for spillage, which means if any milk is spilling out at that time, for a safety we can give extra 5 ml to the baby. For the technique, first we have to wash the cup thoroughly and boil for 10 minutes, and prepare the required amount and add 5 ml extra. Then hold the baby in semi-upright position and support the head and the shoulders, and rest the rim of the cup on the baby's lower lip touching the upper lip. Then tilt the cup just enough so that the milk reaches the baby's lips. Then allow the baby to sip the milk by thereon. Do not pour the milk into the baby's mouth. After feeding, we can burp the baby and place the baby in right lateral position. That is about cup feeding. Then next one is the gavish feeding. Gavish feeding means it is a method of feeding an infant through a nasogastric or orogastric tube directly into the stomach. It is used when the baby is unable to suck or swallow effectively. Indications means for the premature or the low birth weight babies. Then if the baby is having weak sucking and the swallowing reflexes, and if the baby is having any congenital malformations, and if the baby is seriously ill or unconscious, and if the babies cannot feed orally. So next I am going to explain about the technique of gavish feeding. For this, first we have to select the tube, use a size of 5 feeding catheter. Then we have to measure the tube length. For nasogastric tube, we have to measure from the tip of the nose to the tragus of the ear, from there to the xiphoid sternum. For orogastric tube, we have to measure from the corner of the mouth to the tragus of the ear, from there to the xiphoid sternum. Then we have to insert the tube. Keep the baby's head slightly raised. Wet the catheter with the water. We should not lubricate with the oil. Then we have to gently pass the tube through the nose or the mouth into the stomach. After that, we have to check the tube placement. For that, we have to aspirate a small amount of gastric conduct to confirm the tube is in the stomach. And then we have to secure the tube. For that, we have to fix the tube to the baby's cheek by using adhesive tape. Then we have to start to give the feed. Attach a 5 ml or 10 ml syringe without the plunger. Then pour the milk slowly into the syringe and then allow it to flow into the stomach by gravity. We should not force the feed. After the feeding, we have to place the baby in a right lateral position, and burping is not required for the gavage feeding. Then the NG tube or the OG tube may be left in place for up to 7 days if it is required. Then I am going to explain about some problems which is associated to the artificial feeding. So first one is the constipation, which means due to the undigested protein there may be the chances of occurrences of constipation. Then underfeeding, which leads to poor growth. Overfeeding, which leads to vomiting and discomfort to the child. Then aerophagy, which means if the baby is swallowing air, at that time it will lead to abdominal distension or colic pain and aspiration. Then acidosis, which may happen due to the low pH formulas, and malnutrition will occur if the feeds are over diluted, and it is very expensive and time consuming to prepare, and there may be high risk of infection if feeding utensils are not clean. And cow's milk contains high sodium and phosphorus, which increase the kidney solute load and also predisposing to hypertonic dehydration. Then artificially fed infants have a higher risk of developing gastroenteritis, anemia, hyperphosphatemia, hypocalcemia, and latent or clinical scurvy. That is about the problems. Then I am going to explain about the complementary feeding or weaning. Complementary feeding or weaning is the process of introducing foods and liquids other than breast milk. We are introducing or we are start to giving foods which is other than the breast milk for the babies only after the month of 6, and along with that we are continuing the breastfeeding up to the 2 years, and it is done because breast milk alone is no longer enough to meet the nutritional needs of the growing baby. So weaning is also the gradual process by which the infant becomes accustomed to the family diet. And why the complementary feeding started at 6 months? Because breast milk alone cannot able to meet the requirement of the baby, and also baby is developmentally ready to eat other type of foods, and the teeth start to erupt between the 6 to 8 months, so it will help the baby to bite and chew other type of foods. And also the digestive system of the baby will get matured enough to digest the starch, protein and other kind of fats, and by the age of 6 to 9 months the baby can able to hold the food in the mouth and able to swallow better. That's why we are starting the complementary food at 6 months of the age. Then what all are the guiding principles we should follow while we are giving the complementary feeding or weaning to the baby? We have to start complementary feeding at 6 months. For the first 6 months we should give exclusive breastfeeding, and by the during the 6 month we have to introduce the complementary food, and along with that we should continue the breastfeeding up to 2 years, and continue on demand breastfeeding, which means we have to breastfeed the baby whenever the baby wants the milk. Then practice responsive feeding, which means we should feed the baby slowly and patiently. We have to encourage them to eat the food, but we should not force them to eat. And we have to try different type of food, different taste and textures if the child is refusing one type of food, and also avoid other type of distractions during the time of feeding. The next one is we should maintain proper hygiene. We have to wash the hands before preparing the food, and also we have to maintain the cleanliness of the utensils, and also prepare and store the food safely to prevent diarrhea. Then start with small quantities. We have to first begin with 1 to 2 teaspoons of soft foods. Then we have to gradually increase the amount of the food as the child is growing. Then next one is increase food consistency gradually, which means during 6 months we should start with the liquid and soft foods, and by 8 months we can give semi-solid food, and by the 12th month we can give the family foods, that means the solid foods. And then increase the meal frequency, which means during 6 to 8 months 2 to 3 meals per day we can give, and by the month of 9 to 23 we can give 3 to 4 meals per day, and with some healthy snacks if the baby is needed. Then we should give variety of nutritional food, which means we have to include all the type of nutritious food into the diet of the baby, like cereals, grains, pulses, milk or milk products, egg, fish, meat, fruits and vegetables, and oils and fats. All these should included. Then next one is we should provide micronutrients to the baby, like iron-rich food or vitamin A, calcium and other vitamins and minerals. And also we can give the supplements if advised or prescribed by the doctor. The next one is introduce one new food at a time. First we have to start with 1 to 2 teaspoons. Then we should give new food or new type of food during the daytime only, and continue for a few days before introducing another type of food. And we should observe any allergy or intolerance to a certain type of food that we have to notice. So today we discussed about the nutritional needs of the children. Under that, about breastfeeding, exclusive breastfeeding, artificial feeding and weaning.